Gynecomastia is a procedure, like many procedures in plastic surgery, that are often combined with other procedures. So because we're using liposuction sometimes to contour the chest area, as well as sometimes using an actual incision to take out some breast tissue, often men will ask to have liposuction of other areas, other problem areas, like the love handles or areas that have never really been able to change with diet and exercise. And so just like in cosmetic liposuction, where it's ideal for patients who have fatty tissue that hasn't responded to diet and exercise, gynecomastia is a procedure that in a similar nature uses liposuction to contour those problem areas. And so it's very common for men to have liposuction of other areas of the abdomen or torso at the same time. So the recovery for gynecomastia is very much like the recovery for simple liposuction, which in general is about a week of taking it easy. Certainly the first 3 to 4 days are kind of the peak of swelling and discomfort. Most men will find that sometime in that first week after surgery, they can get back to their normal working activities. In terms of working out, exercise, cardiac activity, intense exercise and lifting, those type of activities usually need to wait for at least the first 3 to 4 weeks or so. Generally what we do is we have men gradually increase their activities. The first week is activities of daily living, things around the house, driving once you're off narcotics and feel comfortable and safe to operate a vehicle. By the second week, men can start doing increased activities, longer distance of walking, light cardio activity. By weeks 3 through 6, the intensity can start to increase. And we usually guide patients step by step through those processes. It is important to understand for men who like to weight lift and work out at a more strenuous level that some of those activities are going to need to wait for closer to a month just to ensure that we don't have any complications or unexpected events. So after gynecomastia surgery, it's normal for men to wear what we call a compression garment, which is a garment that's very much like a t-shirt or a tank top that fits tighter, that provides compression to the area to control swelling. This garment's easily concealed within or underneath clothing, and most men tolerate it just fine. It's important to wear both at morning and in the evenings while you sleep for the first 3 weeks. Certainly it can be removed for showering and bathing. For the next 3 weeks, or between week 3 and week 6, we often will let men just wear it during the day, removing it in the evenings. When looking for a surgeon who performs gynecomastia surgery, or what sometimes is called male breast reduction surgery, it's very important that you look for a board-certified plastic surgeon. Certainly there's lots of surgeons who perform these type of procedures. Even general surgeons perform them to a certain extent. But I think the cosmetic nature of this procedure and the need to conceal scarring and to make the evidence that the procedure's been done as limited as possible lends itself towards choosing a board-certified plastic surgeon. And certainly, even amongst board-certified plastic surgeons, it's important to know that your surgeon has performed this procedure numerous times before. These type of surgeries, male gynecomastia procedures, are among the fastest growing part of our practice here at Park Meadows Cosmetic Surgery. We perform numerous procedures every month and certainly throughout the year, all seasons of the year. And so I think as you choose a doctor, it's finding a doctor who is skilled in this area and who performs this procedure regularly.